We've got some really hot buttons that we're dealing with in healthcare now. In my 30 years in healthcare, I don't think I've ever seen a time where we faced greater peril, faced greater challenges. When in the mid-60s, when we went to the Medicare program, everybody predicted the end of healthcare. In the mid-80s, we had TEFRA and DRGs, and everybody predicted that hundreds of hospitals would close. And this time they were right. A lot of hospitals did close, particularly those who had bad balance sheets and were in poor markets and hadn't planned ahead. And when we did the Balanced Budget Act of 1998, there were more dire predictions, but most of the strong hospitals, the innovative hospitals, survived. Well, today, we face a graver crisis. What's the significance about January 1st, 2010? That was the first day, the first hour, that baby boomers like myself could qualify for Social Security and Medicare. The dikes have opened. Over the next 20, 25 years, 70 million people will become beneficiaries of the American social welfare safety net, Social Security and Medicare. This is something we've been known about for a long time. Actuarially, they didn't really account for it when they started the programs, but today it is a tsunami of extraordinary magnitude and importance. So that started on January 1st, 2010. What's the biggest driver of federal deficits? Well, in the great rancorous political discourse in the country, people want to single out aid for dependent children. They want to talk about foreign aid. They want to talk about wasteful earmarks. Not even 2% of the national debt is driven by those issues. It's remarkable. I've taken the exercise of cutting the budget, and I really cut a lot and didn't even get past 40% of reducing the annual deficit. What's the biggest driver? It's Medicare. What's the second biggest driver? It's going to be Social Security and then defense. Historically, politicians haven't wanted to touch any of those three things, but now we don't have much of a choice. The third big hot button, and it's a really important one, and it's even a bigger one, is what is the biggest part of the unfunded liabilities? The United States, like a lot of companies, have certain liabilities that are off the balance sheet. The biggest portion of the unfunded liabilities that we're going to talk about in just a minute is, again, Medicare. And finally, we need to look at the fact of how will this retirement of the baby boomers really impact our financial crisis as a nation. And all I can say today is it will be significant, and it will bring about change that we could not have possibly imagined. Finally, what will become of Generation X and Generation Y? They're the people that actually have to pay the bill.